bacteria, Jules, ordet, and Octave Gengou, and world distribution, and symptoms and effects. Then I will be going into diagnosis, treatments, vaccines, and an experiment and some controversy with vaccines. So I will begin with the background. Pertussis is also known as whooping cough. It attacks the human respiratory system and attaches to the cilia in the lungs, which are hair-like protectors. It's caused by the bacteria Pertussis, and it's seen mostly in children. This is a picture of the human respiratory system, so the cilia would be in the lungs here. So the Pertussis bacteria is human-specific, which means the disease itself is only found in humans. It requires a host to keep from mutating. It releases toxins, which are responsible for the disease, and it releases adhesives, which help the bacteria to stick to the cilia. It was also discovered in 1900 by Jules, ordet, and Octave Gengou. This is the bacteria itself, Pertussis, and these are some of the toxins. Here it is attaching to the cilia. So Jules, ordet, and Octave Gengou. They were the two scientists who discovered the Pertussis bacteria. They discovered it in 1900 in Paris. They isolated the bacteria to study, which is why they're so famous, because it was notoriously hard to isolate at the time. They did that in 1906 using the ordet Gengou medium, which is a type of agar. It's also commonly referred to as BG medium. So the history. The Pertussis disease first emerged in 1414 in France, and the first known epidemic was in 1578. The first vaccine was created in 1948, and it caused about 8,000 deaths in the U.S. before the vaccine. So world distribution. It is emerging in developed countries with high vaccination rates, often over 95%. There are 60 million cases per year, and there are 300,000 deaths worldwide, but these are mostly in unvaccinated children. So symptoms and effects. The uncontrollable cough, which gives pertussis its name, makes a whooping sound when the person cannot catch their breath. It can result in cracked ribs, broken blood vessels, and hernias. It can also result in pneumonia, apnea, and it can be fatal, especially in small children and infants. Here is a picture of a child with pertussis, and he has broken blood vessels in his eyes and bruises under his eyes from coughing. So, diagnosis. First, they will ask you of a history of your symptoms. They will give you a physical examination, a blood test, and a laboratory test, which is where they take secretions or saliva from the back of your throat, and they will send that to a laboratory to see if you're positive. This is a picture of someone getting a laboratory test. So what they do is they stick a tube down your nose into the back of your throat to get the secretions. So treatments. So most of the treatments are antibiotics, which are zithromycin, clarithromycin, and erythromycin. Early treatment is important because it makes your symptoms less severe, and it also helps stop the spread of the disease. Some infants are treated in the hospital because the symptoms can be so severe, and there's no cure, but the treatments do act as a cure. This is a picture of an infant being treated in the hospital for pertussis. So vaccines. So there are two types of vaccines. DTaP, which is used for children under 7, and it's given in a series. The first is at 2 months, the second is at 4 months, then 6 months, 15 to 18 months, and then 4 to 6 years. And then Tdap, which is used for children over 7, it's used for booster shots, and also it's used for adults, so parents and child care providers. So there are also two types of vaccines within the two. The whole cell vaccine, which uses the entire deactivated cell, it's a more effective vaccination than the acellular vaccine, but it has contradicting side effects. The acellular vaccine uses deactivated proteins, which are called toxins, in the bacteria, and they are called toxoids when they're deactivated. The chance of side effects is less likely than the whole cell vaccine. So here's a table of the vaccines. The symptoms are basically the same with the exception of fretfulness, and hypotonic hyperresponsive syndrome, which is poor muscle tone. Also, in the whole cell vaccine, the side effects can be in up to 1/2 of recipients, while in the acellular vaccine, it can be in up to 1/3 of recipients. So an experiment. The purpose of the experiment was to compare the effectiveness of the whole cell and acellular vaccines in teenagers. So the methodology. They did a case control study conducted among people born from 1994 through 1999 who had received 4 clinical vaccines from infancy to 2 years old. They then compared PCR positive cases, PCR negative cases, and control cases for pertussis. And they measured the risk of pertussis in relation to what type of vaccine the recipients had received. So the results. The results of the experiment were that those who received 4 acellular vaccines were more likely to test positive for the pertussis disease. And they concluded that those who had the whole cell vaccine would be more protected in an outbreak of pertussis than those who received the acellular vaccine. So vaccine controversy. The whole cell vaccine had conflicting effects, which caused lower rates of immunization, and in return it caused epidemics. So 2 in Great Britain, 1 from 1977 to 1979, which caused 102,005 cases, 500 cases. And in Great Britain, it also had an epidemic from 1982 to 1983. In Japan, it had another epidemic in 1979, which had 13,105 cases, 41 deaths, and it also spurred the movement towards a safer vaccine, which was the acellular vaccine. Here are my acknowledgments, my bibliography, and I will now open the floor to any questions, comments, or constructive criticism.
So the first known epidemic was in 1578. Do you know where it was?
I believe it was in France, but I'm not quite sure.
You mentioned hernias. What are those?
Hernias. I did not come across that in my research. Alexis?
Why is it more common or more prevalent in children than adults?
I am not quite sure, but I believe it's because the acellular vaccine can cause lower immunity rates. So as you get older, the less immune you become towards the pertussis disease.
You mentioned that the people who usually get pertussis are, you said that pertussis is emerging in developed countries and people who've gotten the vaccine. Why do you think it is emerging in those people if they've already gotten the vaccine? How come they're still getting the disease?
Because though the vaccine is very effective when you first get it, the longer you have without having the vaccine, the lower your immunity rate becomes. So eventually you will be unimmune to the disease.
Okay, so do most people keep getting booster shots of the vaccine throughout their entire life, or is it mostly just in childhood?
It's mostly in childhood, but once parents are starting families, they then get vaccines to make sure that the baby doesn't get it, because before 2 months, infants cannot get vaccines. So they have to make sure that they themselves are immune.
So you mentioned that there are 2 types of vaccines, the whole cell or the whatever, and the acellular vaccine. Why would someone want to get the acellular vaccine over the whole cell
Because
vaccine?
it's less dangerous, so though it's less effective as time goes on, the whole cell vaccine has more devastating side effects. It can have neurological side effects, seizures, and there's more chance of getting those side effects.
Okay, and did you come across any sort of like future research about maybe developing another vaccine or anything like that?
They are doing some research on trying to find a safer way for the vaccine to make it more effective.
Any other questions? No? Okay.